On July 3rd, 2009, my life was to be altered forever. Larry, my husband for 51 years, had ataxia, a chronic condition characterized by cerebellar degeneration that affected his balance and coordination. His mobility was becoming increasingly compromised, and on this particular day, he had fallen 2 times on the tile floor. Being a large man, I was unable to get him up. I called 911, and an ambulance took him to the ER at a local hospital. For hours, he underwent tests and procedures. He was then taken to a room where he remained for 8 days, undergoing PT, being medicated, and further testing and monitoring. At this point, he could walk only a few yards with 2 men supporting him. On the 5th day, a neurologist, flanked by Larry's doctor and a social worker, ushered me into the hall and said, "We're sorry, but your husband was never admitted." I was stunned with disbelief. Wristband, IV, PT, low salt diet due to unusually high blood pressure. Criteria for admission appeared obvious. I tearfully blurted that I was going to fight this, whereupon Larry's doctor and the social worker both gave me the thumbs up sign, saying that this happens at least once or twice a week. After stabilizing his blood pressure, he was released on July 10th and taken by ambulance to a rehab facility as a private pay patient, since the 3-day rule did not apply. He remained for 3 months, suffering various symptoms and becoming increasingly despondent. Gallbladder removal was another sidelight during this interim. Against my better judgment, I relented to my grown children's desire to bring him home, thinking it would perk him up and he would start eating again. Only with around-the-clock nursing care was his doctor's conditional ultimatum. He was home 24 hours when his blood pressure became dangerously low and he was severely dehydrated. His primary doctor ordered him to the hospital, a different one, by ambulance. 6 days later, he was dead from pancreatic cancer. Clearly, there is something wrong with this scenario. Keeping my vow not to capitulate, I worked with the Center for Medicare Advocacy, which is excellent. I eventually had a hearing where everyone felt the results were very positive. 6 months later, it was denied. I keep thinking of past and future victims who might not have the awareness level or tenacity to navigate this economically driven system. I can only say the impact is devastating. Thank you.